Hello everyone, and thank you for joining today's LinkedIn Live. My name's Aneta Gel and I work as a Quality Operations and Training Manager at Pharma Limited. Today, we are going to talk about a question that matters to people at every stage of their pharmaceutical career, and that is, what do pharma companies look for when they are hiring or promoting in 2026? I want to frame this webinar as a kind of personal development session rather than a recruitment focus session. The aim is to help you understand what you can actively build, the skills, the behaviors, training, and evidence that make you easier to trust with the next opportunity. Throughout my experience, I have learned that it is the combination of all aspects that we will talk about, the knowledge and expertise, the human elements that do matter. And of course, as we are moving into the world of AI, I believe the human part of the abilities will be more important than ever before. Whether you are early in your career or an experienced specialist or supervisor, a manager, or you are preparing for your next senior expert role, there will be something practical here for you. So let's start. Let me start by setting the direction of the session. This is a candidate-centered guide, so we are looking at the topic from your perspective. What can you do to improve your chances of being hired, retained, promoted at any level? The important point is that the answer is not only get more experience. Experience matters, but in 2026, employers want to see evidence that you are developing into the right direction. That means we need to have strong regulated competence. We need to have comprehensive digital awareness, and we need to have the ability to work with people and have a habit of wanting to continuously learn. I don't know about you, but I have discovered that more things I learn, the more I realize how much I have yet to learn, and we should never stop learning. So back to the requirements that I mentioned, they apply at every level, whatever level you are at. And then there is a but here, the evidence that is expected from you becomes bigger and broader as your career progresses. Okay. Today, what are we going to do? So my aim is to help you do 4 things. The first one is to understand the 2026 signals. What pharma employees are increasingly screening for? They are looking for evidence, adaptability, and regulated judgment. Second one, you need to assess your own profile using the T-shaped model that I will talk about. This helps you to identify where you need more specialist depth or where you need your broader skills around the digital data or communication or cross-functional working. The third, think about training as a pathway and not just a certificate that you get at the end of it. The right training should strengthen your capability and help you perform better in real situations. And the fourth, turn development into proof. In interviews, appraisals, and promotion conversation, it is not enough to say, oh, I attended the course and I have the certificate. You need to be able to show what has changed because of that training that you attended, how your mindset has shifted, how you change the way you look at things, for example, your deviations or auditing or process validation because of the course that you attended and the things that you've learned. What you can see on this slide is that the hiring and the promotion bar has shifted over the years. Technical knowledge still matters, especially in pharma, of course, where patient safety and compliance are non-negotiable. But the technical knowledge on its own is no longer enough. On the left, you can see what is less convincing now in 2026. So we have the long tenure without much evidence. We have the generic responsibilities, certificates with no application, and a lot of technical depth, but without the adjacent skills. Or we've got people that are waiting for someone else to manage their development. Long tenure in one place may be perceived nowadays as being less adaptable. I remember doing my first audit of another pharma company once I've been in my company for around 5 years. And I remember how I had to adjust to the fact that just because the other company was doing things differently, it didn't mean that they were doing it wrong. And because I thought our way was the only way, I needed to rethink that. And I was lucky enough, I had a good mentor and I adapted. And now I use this knowledge when I train others when it comes to auditing or any other subject. The best way is to use your own examples, your own experience to make the training personal and really valid. Technical expertise in isolation, again, may be seen as a little bit of a risk because it can show that there is less adaptability and flexibility in today's fast-paced world of changes. And on the right side, what you can see is what's more convincing today. Measurable outcomes, competency-based examples, and training applied to real work. Depth combined with digital fluency and human skills. And also the signs of taking ownership of your development plan. You can have an exceptional expertise knowledge, but with pure human skills, it will reduce your chances of further promotion quite significantly, because you need to be able to work with people. And if your communication skills or human skills in general are not ideal, then that's not what the employers want to see. So the mindset shifts. The shift is this. So you don't ask only what role can I get. You need to ask what capabilities can I prove, can I showcase? And this is the question that changes how you prepare your CV, your interview examples, and how you promote your case. Okay, so here we have a useful way to structure your development, excuse me, which is so-called the T-shaped profile. The vertical part of the T is your specialist depth. In pharma, that might be quality assurance, quality control, production, validation or regulatory affairs, or even clinical operations, pharmacovigilance, supply chains, or any other specialist area. This is where you need a real competence and not superficial familiarity. The horizontal part of the T is your breadth, and this includes digital fluency, communication, collaboration, regulatory understanding. So not just knowing what the regulations are, but understanding what that regulation means, data confidence, and ability to work across functions. Your personal development move is simple. You choose one depth skill and one breadth skill, and you to build now or or tomorrow or from now on. For example, you might strengthen kappa and root cause analysis as your depth skill, and presentation or data dashboard interpretation as your breadth skill. And then you build evidence that you can show that you've applied both. For every level in pharma, the regulated foundations do matter. You need to show that you understand quality, compliance, and a patient-focused decision-making. GMP and GXP thinking means understanding why controls exist, not just following a procedure mechanically. Data integrity means applying your Alcoa ++ behaviors in daily work and not only remembering what the acronym means. And this is what inspectors and auditors are looking for when they come to inspect your facilities. They want to see that the operators understand why they need to stop and report when something goes wrong, not just because it says it in their SOP. Deviation and kappa capability is especially valuable because it shows how you think when something has gone wrong. And employers want people who can investigate properly, that identify the root cause, and they create actions that actually prevent a recurrence. Quality risk management, validation, change control, and regulatory literacy all help you make better decisions. And the training to consider here includes GMP refreshers, data integrity, quality risk management, kappas and root causes, or your validation basics, whatever you feel that you need to improve on. And the goal is not just to collect courses. The goal is to become more reliable in a regulating environment, which a pharmaceutical industry is, in a regulatory environment. And the courses will give you the tools, and then you need to collect the situation and outcomes where you can show and prove that you've used the tools and that they were beneficial to a good or better outcome. The next area to focus on is digital, data and AI fluency. You don't need to become a programmer, but you need to have enough confidence to work safely and intelligently with the new digital systems and data that they create. Some people hate the new digital age, but hating it is not going to make it away. Embracing it will move you on and will give you the options, and you will not stay behind. My father is 85 years old, and the last time I saw him a couple of months ago in person, he wanted me to teach him how to pay using a QR code on his phone. And I thought that was amazing. He's 85 years old and he still wants to learn. He knows how to pay with his card and through online banking, but he knows QR code exists and he wants to learn how to do it. Of course, it took us a number of times and he moves a little bit slowly, but he moves with today's times, and he refuses to stay behind. And we all need to do the same. For many pharma roles, that means being able to read trends, dashboards, and quality metrics critically. It means asking, what does the data prove? What does it not prove? And whether the source that the data come from is reliable. AI awareness is becoming increasingly important, and the candidates do not need to know everything about AI, but they should understand its possible uses, its limitations, of course, the bias risks, and the validation considerations. And the need for the human oversight in the regulated work is extra important. Years ago, the queue in your job applications or the job adverts was, can you work with Microsoft Office? And now it's going to be, can you work with AI? System thinking also matters. If you work with electronic QMS, LIMS, ERPs, you should understand how these systems connect to compliance and process performance. And practice safely. Use approved systems. Start with the business questions and then validate the outputs, document assumptions, and you translate insight into improvement. When technical skills are broadly similar, human skills often decide who is selected and who progresses in the interview process. Critical thinking matters because pharma work is full of decisions where you must weigh evidence, challenge assumptions, and explain your reasoning for your decision making. Communication matters because complex technical information has to become clear to whoever you speak to, whether you speak to operators, whether you speak to quality assurance, quality control, production, or senior leaders, suppliers, or even auditors. Each audience needs clarity. And if you want to influence people into, for example, correct way of doing things, communication skills and the human element is of paramount importance. Collaboration matters because very little in pharma is done by one function alone. You have quality, you have production, regulatory, supply chain, and technical teams all having to work together. And again, this is hugely interconnected with your communication skills. Can you speak to people at different levels with the respect and cordiality without people getting upset or feeling humiliated? Very important part. Adaptability also matters because tools, regulations, and priorities change. Your business needs change. Ethics and integrity matters because patient safety must remain central. Even under pressure, patient safety is number one priority. Training is a very, very helpful tool here. Communication, influencing without authority, problem solving, leadership foundations, coaching, or conflict management, which is important if you want to work and manage teams. How are you going to manage if conflict arises? And when you work with people, conflict does tend to arise. So there is training for all these things that they can help you to prepare for your next role. Info on this slide is very important because the message applies again to every level and not just to senior managers. If you are early in your career, you focus on strengthening your GMP habits, your accurate documentation, asking the correct question, and volunteering for any improvements or any tasks that are outside your everyday responsibilities. Because what you're doing is you are building trust and reliability, and you're showing your managers that you are willing to go further. If you are an experienced specialist, become known for solving problems that others are trying to avoid or they don't want to look at them because they are more difficult. Once you are trained and you have experience and knowledge, train other colleagues, share your knowledge and lead improvements that they create measurable results. Don't hold your information. Don't be afraid to pass your knowledge on. If you are a supervisor or a team leader, your evidence will shift more towards coaching or prioritization, having the good judgment when to escalate, and cross-functional delivery, especially when under pressure. If you are a manager or a senior expert, you need to be able to connect technical decisions to a strategy, patient outcomes, to risks, to cost, and to development. And the key principle is, do not wait until you have the little to practice the behaviors of the next level. Start demonstrating then now. Start working towards your next position, your next job, while you are still in your current job or current position. So, training as a development system. So, training will improve your career prospects when it becomes part of your development system, not in isolation. The cycle needs to start with your diagnosis of what do you need. Be honest about where you are now and what the gaps are. Do you need stronger GMP knowledge or better investigation skills? Do you need more confidence in communication across different departments, across different levels? And once you find those gaps and you identify them, then choose a targeted training. And after the training, try to apply it quickly in the real work environment. This is where a lot of people kind of slow down or stop too early, because they go on a training course, they learn something, and they don't do anything with it. The course is useful only when it changes what you do when you go back to work. Course should change your approach to that specific subject. It should shift your view, and you should start looking at things slightly differently to how you look at them before you went on the course. And finally, you start creating evidence. That evidence might be that you have better deviation investigations, you have improved documentation, or much stronger CAPAs where effectiveness is passing and not failing, a clearer dashboard, a smoother audits, and even a positive feedback from your project team. The best development mix is when you have a formal training and on-the-job practice, where you have mentoring or coaching, where you actively ask for structured feedback and you perform an honest reflection. The certificates may open a conversation for you, but your changed capability builds credibility. And that's a key point. I have prepared here a quick and easy to understand and follow development checklist. If you like, use this checklist as a living career tool. You can use it before applying for a role, before an interview, or even appraisal, or when you are preparing for that promotion conversation that you want to have with your boss. For core expertise, ask yourself, can I explain my pharma expertise with a specific example and a measurable impact? For digital and data fluency, ask yourself, have I strengthened at least one relevant skill? And can I explain how I use it safely in the regulated work? For applied learning, you ask yourself, can I show how the training changed my behavior, how it improved the outcome of my work? For human skills, do I have a concrete example of good collaboration or communication and professional judgment? And for readiness, you ask yourself, can I clearly explain the level I am preparing for and the evidence that I am building towards it? In 2026, candidates improve their chances by becoming easier to trust with responsibility. You want to be hired because your new employer, from the interview that they've had with you, feels they can trust you with the responsibility that they will put on you in your new role. And here we are at the end of today's session. I want to end by saying thank you for joining me today. I hope you found this session helpful and that you think about your career development now in practical and more structured way. The key message here is that the skills are built before opportunities appear. If you want the next role, the next promotion, or the next level of responsibility in your current in your current job, start building the knowledge and the judgment and the evidence for it now. I have a nice analogy to leave with that I heard from my friend many years ago, which was, do not dress for the job you have, but dress for the job you want. If you would like support with the development, please visit our website and explore the courses available through the Academy of Pharmaceutical Excellence. You will find the training that can strengthen your pharma profile, which includes GMP and GXP good documentation practice, data integrity, deviations, auditing, technical agreements, writing, and AI literacy for pharma professionals. These courses are designed to help professionals at different levels to build on their careers in different stages and build the confidence and improve their chances for preparing for that next position. Thank you again for your time, and I wish you every success in your next step. If you wish to contact me directly, please contact me on anetagel@pqs.ltd. Thank you very much and have a lovely rest of the day. Bye-bye.